Hello everyone and welcome to this My UEG community session. This is Superfood for Thought, Prepping for the Future of Education. My name is Charlie Murray. I'm the chair of the UEG Education Committee, and I'm really happy and proud to be joined today by two experts in this field. We feel in UEG that we want to be in the front foot of medical education, and we strive to do that in the Education Committee. And we've got some real experts in that field of future-proofing medical education. And I'd like them to introduce themselves to you now. So without further ado, Sophia, could you introduce yourself, please?
Yes, of course. So I'm Sophia, and I'm a fifth-year medical student at the University of Turin. And I also founded Omnes Education, which is a company that works towards ensuring equity of opportunity in medicine. But my work in medical education over the last years has actually been in quite a few roles, such as serving a term with the European Medical Students Association as the health policy director and being a TEDx speaker last summer, as well as through being a student representative for my university and other organizations.
Thank you, Sophia. And Hashem?
My name is Hashem Al-Ghaili, and I am from Yemen. I graduated from Jacobs University in Bremen, and I'm currently working as a full-time science communicator. I publish scientific content in a simplified and engaging manner in video format across different social media platforms such as YouTube, Facebook, Twitter, LinkedIn, TikTok. And part of the topics that I cover include medical topics. And I recently gave a TEDx talk on the future of education.
Thank you very much, Hashem and Sophia. Great to have you with us today. So just to let you know before we move on, this is going to be an interactive session. So there'll be audience questions, specific questions that you can answer. There is the chat available throughout the next hour or so. And I'll keep an eye on that for your questions. And there will be times where we want you to type in word answers so that we can perform a word cloud to see what the most common answer, the most popular answers are, so that we can discuss things further. So do be ready to interact. We'll try and get round to as many questions as we can throughout the presentation. So shall we have the next slide? So I think it's fair to say that having been in the UEG Education Committee now for the last 3 years or so, we have been a committee of great innovation in that we've had lots of ideas that have come to fruition. We've had our Mistakes In series. We've had a lot of good webinars, especially through the COVID-19 pandemic. And we've been very strong in the last years in online courses. And that's been incredibly successful. But we're striving throughout this time, however, to think about how we might educate in different and better ways. Now, I'd just like to ask our panelists before we go on, what is the thing that you're most excited for in medical education? Sophia?
For me, being a medical student, I think the most exciting thing is seeing how things that we're talking about with Hashem also on our TEDx talks, and basically the things that we're passionate about in medical education, such as bringing in technology, for example, into the curriculum, let's say in digital health, et cetera, how that's going to impact my clinical experience for me personally, like to see it basically in the hospital, to see the basic knowledge that we have being supported by technology, but in real life and in practice. So for me, definitely, that's something I'm very excited about.
And how about you, Hashem?
For me, I'm more excited about the fact that most of the knowledge in the medical fields are now becoming visualized, easy to access and easy to understand. And I mean, just think about it. In the past, you would read a textbook which describes a certain medical procedure, but now you can watch an animation which really simplifies the procedure and makes it more accessible to more people.
Excellent. Thank you for the answers. So I think we're going to move on to our first question here to get you engaged early. Can we have the first question up? So does the current education system neglect students' personal interests and bombard them with unnecessary subjects? Well, we'll leave you to answer that question for a couple of minutes or so you have a chance to get your answers in. Sophia, do you think this is the case? Do you think a lot of what we are bombarded with is unnecessary?
I think this question is quite provocative for a good reason, in the sense of, I don't think there are necessarily unnecessary subjects at the beginning of my basically medical education, at least in med school. I would have definitely liked to see, let's say, more personalization in the curriculum, but I think that overall there's sort of a baseline of curriculum and knowledge that we need to have, and sometimes they seem unnecessary because we develop personal interests in other areas and we're not so interested maybe in the things that we have to learn. But I feel there's maybe a logic there, but it would be great to see also the integration of personal interests into the curriculum, so to leave room essentially for personalization. But yeah, I'd say yes in the end.
Okay. Well, I've been a bit cruel because I put you on the spot before anyone's answered. Before Hashem answers, I think, shall we have the answers up now from the crowd? Can we do that? Okay.
Oh, wow. Very.
So I think they agree with the question. So Hashem, how does that frame your thoughts about what are we doing in medical education? I mean, we're obviously letting everyone down.
I think it really does neglect the personal interests, and it bombards students with unnecessary subjects. If you notice, there is a lot of students who end up after 3 or 4 years of spending or studying certain field, they find that they were interested in something else. So we can't really say, our subjects or our interests are rigid and they are fixed to a certain time. As we move forward and as we go on, our interests develop. And it's very important for the educational system to be adaptable according to the interests that evolve with time.
No, I agree with all of that. Sophia, any further points now that you've seen this devastating result from our audience?
I think it's unsurprising, because I definitely feel like those who probably attend this session are actively engaged, or at least are actively interested in the development of medical education. And I think that the rigidity of basically all curricula, at least across Europe, from the schools that I know, it's quite restrictive, and it means that the exploration that we do, for example, that I did in terms of business medical education in general, and my interest beyond, so specialty wise, a lot of that has to come from yourself. And maybe because of that, it seems like we're being bombarded unnecessarily, because we kind of have to explore by ourselves while still succumbing to sort of quite a rigid structure that we have to follow without essentially having a choice. And yeah. So for that reason, I'm not surprised at all.
Okay, so let's follow that on a bit more and to just see if we can explore that. Sophia, I think you've got a question, haven't you, about for our first word cloud?
Yep. So the question that I'll follow Charles on with is essentially what has been an issue for you personally in medical education. And whilst you're sharing your thoughts in the word cloud that we'll soon be able to see, I mean, Hashem, do you have some thoughts on this?
Honestly, I would say the issue with the medical education right now is the reliance on outdated information. As you know, the medical field continues to evolve every second. And so when you look at the curriculum, you would see that a lot of things still rely on information that are outdated, and they're not really updated. And you can't rely on students all the time to go and search for these things by themselves. It takes a lot of self-motivation, and honestly, not everybody has it. So that's one of the issues that I see in the medical education right now.
Yeah, and I'd agree with that. And I think that the relative inability of the medical faculties to actually move quickly and at speed with the times is something that we see. So curricula that are based on old data that then become commonplace medical education for the next 5 to 10 years. I think Hashem speaks to that very well. We're learning things that are out of date as they're put down in front of us.
Absolutely. I would agree with that. And for now, can we also see maybe the results of those who are participating in the session? High mentor to student ratios, not much memorization, less rationalization. I think for sure outdated information is something that I feel much more now, sort of going into the clinical years, because I feel beyond the idea of outdated information, I think the biggest issue for me personally is kind of all of these in one, which is the lack of sort of a centralized space to understand what opportunities there are, you know, accessing mentors and people who can help you understand where you want to evolve and maybe give you access to the information that is up to date because of current research. And so there's kind of a disconnect between, let's say, the point where I, at least from my point of view as a student, where I feel like I'm in a classroom, I feel like I'm learning textbooks essentially, rather than connecting everything together, which is the obviously clinical practical skills with the theory, but under the umbrella, or let's say supported by the up-to-date methods and sort of getting engaged in progressing forwards essentially, rather than just kind of learning what has been in a book for maybe a decade or something like that. So I think we're all in agreement actually. Yeah.
Looking at just the overload sticks out to me. How do we avoid overload in medical education?
Well, I think that's a very, very difficult question. And it's for sure based on your person, essentially. I think there's no single answer. I think there are a lot of suggestions that have been given to me, but almost throughout my entire life in school and med school and sports, etc., which is a balance, let's say, but balance of what? And that balance is very difficult to curate, let's say, without support of a network, which is kind of what I feel is missing a lot of the time. So actually, that's kind of why I grouped everything together, because mentorship, access to a network of students, all of that is helpful in supporting you essentially as an individual to try and learn how to manage your own stresses, how to manage your own views and develop quite a unique, let's say, view of medicine so that you could be an active part of the future. And all of that, of course, is very pressurizing. So overload, I guess, encapsulates all of that. And I think a network essentially is how you overcome that, because you learn, you talk, and you find support in others as well as others.
Excellent answer. Yeah, thank you so much for that. So I think we're going to move on to the next word cloud question, actually, because that follows on nicely. Can we have that up? I can tell you the question. There you go. So why do you think change in medical education is necessary? Hashem, I think you've told us this already, actually, but why don't you say what you think to this question?
As I said, first of all, we have been relying on the current method for far too long, and it has proven that it does not work as much as we expected. Second, there are a number of issues that I can highlight. First of all, we already mentioned the outdated information. We have the reliance on scoring system that doesn't truly reflect the intelligence of a student or their ability to process information. And, we keep bombarding students with unnecessary subjects instead of making the educational system more personalized and narrow down these information so they can really focus on just what they want to learn, mainly.
Okay. And Sophia, any thoughts about this?
So to add to what Hashem said, I think for me, from the point of view of someone who is a student right now, but will be a physician in some years, I think the biggest reason why we need change is because the people who, like me, are studying right now, we're going to be the workforce, we're going to be the front of basically healthcare for the next decades. And I feel that if we want to change things in our healthcare systems, if we want to change things on a bigger sort of world level, let's say on a macro scale, we have to also think about what kind of education goes into the mentality, the way of thinking, the way of approaching patients, etc., of those who will be healthcare professionals for the next decades to come. And so for me, it's incredibly important, obviously, for my personal development, but also so that I will be able to be part of a community of physicians, essentially, who are delivering best care. And best care on an individual level, but also on a big scale healthcare system level, because I think there are a lot of issues which maybe can be counteracted also with changes in medical education that we'll talk about. So personalized learning, digitization, being aware, developing skills, et cetera, et cetera. So for me, because of that, because there's a connection. So education is definitely integrated into the future of healthcare. Yeah.
Thank you, Sophia. Fantastic. Should we have the word cloud up now? See what the audience had to say. Okay. Now, of course, I now feel that I'm giving all the clues away by asking our experts what they think, because there's a lot of similarities there, aren't there, in what the audience are thinking.
Yeah, I agree with all these word clouds, actually.
Yeah, exactly. So thanks for that. I think that teases out quite nicely, actually, for the next question. Hashem, do you want to ask the next question?
Yes,
two.
I have a question here, which is open for voting. And the question is, if we can see it on screen. So the question is, do you believe grades and exams truly reflect how intelligent a student is? And so I'd like to see.
I think this is also a loaded question, so I'll be very interested to see if there's any split here. Sophia, what do you think?
No, absolutely not. I think I understand why we need sort of standardized testing, but I think there's so many elements of your education, let's say your personal environment, which is not controlled, that might put you at a disadvantage, which is basically what I spoke about in my TED talk. There are so much data and so much research on the idea that actually literally your postcode can increase or decrease your grade. And so considering all the other factors, I mean, socioeconomic ones, mental health, various personality parameters, I think it's completely ridiculous to, let's say, use a standardized test in a non-standardized environment. And so I think that's kind of the paradox of what we have at the moment. But I mean, it's useful maybe on an individual level. So to track your own progress, that would be a way that I would see, let's say, that it would be useful. But personally, I feel from my education in Italy, I actually really benefited from a slightly different way of being assessed, which is essentially through interviews and through cases, etc. And I think the way that the medical schools are using PBL is very useful. And I don't know if it's actually used in exams in the UK, but in Italy, we're essentially doing PBL as problem-based learning, so case-based exams as part of our assessment, obviously written and other exams too. But I definitely don't think that works as it is.
Maybe you can see the result and see what the audience thinks as well.
There you go.
What? All right. Well, I agree with the audience on this one. Yeah. I think that exams and grades do not really reflect the intelligence and the performance of a student, because if you look, it's a format that is repeated. It's a repetitive format. And instead of really putting you in a challenge as a student, it's just putting you in something that is done before. If you just study for the exams, you study for the format of the exam, and you learn how to overcome and maneuver around the questions, you will pass, even if you're not doing well. I mean, I knew a few students who used to play all around the year, not look into the books or anything or stuff. And when it comes to the exam, they're really serious and they prepare and they get better grades than most others who are really hardworking. So it's not a true reflection of a performance of a student.
So I think we have time to discuss that more. You talked about problem-based learning throughout your education, Sophia, in medical school in Italy at the moment. And I believe that happens in lots of other places. But when we're approaching the stage where, particularly in medical education now, where we're about to become practicing doctors, do we still need some form of pass-fail exam?
For sure. I think for sure. I mean, on the level, so what I was talking about is kind of my overall impression up to date, but I had the fortunate experience of living in a lot of countries and actually going through 3 education systems. So a Russian one, an English one, and an Italian one. And I'd say a Russian one is very stereotypically, if you think about what maybe stereotypes about Russian education is, it's very much exactly as it is, very, very stringent, sort of just focused on results and getting basically 100% on whatever you're being tested in. And it very much impacted, let's say, how I viewed education. So when I came to the UK, I was really against education, which was very restricted, for the reason that I experienced at a very young age, kind of an education that doesn't care about my development, but cared about me conforming, let's say. And so I think that these, let's say, standardized tests are super important when we're clinicians, for sure, because I think it's the duty of a doctor to make sure that their knowledge and skills are updated, but it's also the duty of the overseeing bodies to make sure that, let's say, there's some way of controlling and checking this. However, I do think that there needs to be a balance. I don't think it's one or the other. So I think it's kind of finding an in-between where you're allowed to, let's say, have a variety of options, because for some people it's very difficult to test in one or the other ways. And for me, it's always been quite easy. And so actually, I'm not one of the people who suffered through school, in the sense of I was quite finding it relatively fine to go through. But I definitely appreciate what Italy is doing, even though I didn't like it at the beginning, where you have to sit in front of the professor and sort of deal with the cases in a real life situation. So, yeah.
Thank you. And Hashem?
Yeah. Well, personally, I think that an alternative way to the grading system would be group work, as I mentioned in my TEDx. You know, a lot of people have problem communicating their ideas, and that's a problem. Yeah. So the best way is to put them in a challenge where they work as a group. And if you have worked in a group at the university, sometimes one person relies on the rest to do most of the work. And that's, of course, that creates imbalance. But if we integrate technology to monitor the performance of each student and how much they contributed to this group work, and then evaluate them, then we can learn. And as we put them in a group work, they will discuss these ideas. And when they discuss ideas, they can learn how to communicate them better as well. And that would probably be more beneficial than the grading or the exams or the current method of evaluating students.
Yeah.
Thank you. Sophia, do you have another point?
Yeah, I mean, actually, just what Hashem said is really, I think, important in the sense of, I don't think we need to scrap the way that we assess students now, even though it's not perfect, because I actually think what I mentioned in my TED talk is basically the idea that we can use this standardization, like I kind of said at the beginning of this question, to track your own progress. So it's data points which can be inputted to understand your learning better. So it's beneficial from the point of view of individual learning, and obviously looking at various individuals in a group. But I think it's more useful for understanding your own gaps, let's say, so, or gaps in knowledge or gaps in skills or whatever you're missing. And I think it's very useful to obtain data to do standardized tests, but just in a way that's slightly different, in a way that acknowledges the various differences that we have in our backgrounds, in our opportunities, etc. And that's kind of a very big question that I'm exploring now in my work, but it's something that people have been exploring for decades. So I think it's not got one answer, but I definitely think Hashem is totally on the right track. And I think the same. I think group work is really important because, I mean, especially for medics, what are we going to do if we can't work in a group and communicate and sort of take responsibility for our own learning? I think that is what medical school should give us, as well as knowledge of sort of anatomy and physiology. Yeah.
Yeah, well, I couldn't agree more with those last statements there. In fact, I'm glad we're recording this so everyone can write them down, Sophia. Fantastic input from both of you there. So let's move on to something I know you're both very excited by, and we're all excited by on this particular call. So do you think technology is currently well integrated in the educational process? So while you're answering that, the integration of technology, do you think we're up to speed, Hashem?
Absolutely not. I mean, technology has become abundant. It has evolved dramatically, and it's evolving exponentially, actually. And if you look, very little of this has been integrated into the educational system. We still rely on textbooks that are outdated. We still rely on visualizations that were laid down. The foundation for these illustrations are basically from the 1880s and 1990s. And meanwhile, we have technologies that can create amazing illustrations, that can monitor the performance of the student. We have artificial intelligence, virtual reality, augmented reality. When you look at the educational system, how much of that do you see? Not much. I mean, have you ever heard of a school that completely uses artificial intelligence, or let's say augmented reality or artificial reality in these sectors? Not really. I recently saw that a number of hospitals, actually, educational hospitals, started using augmented reality to teach students how to perform surgeries. And that's actually pretty cool. I mean, when you look at it, they can delve deeper into the organs that are created to match exactly what they would do in real life. And this makes it more accessible. If you don't have access, for example, to, let's say, a body to dissect with or something like that, then technology is there to help. And this makes it more accessible to more people. But it's not really well integrated, unfortunately.
Let's see what the audience thinks. I think I know already. Oh no, there you go.
Oh, wow.
So some people obviously have much more in their institutes than maybe we're used to. So Sophia, what do you think about this result? Split down the middle.
Actually, it's sort of what I was going to say. I think the question, educational process, is kind of obviously vague. And so it would depend. I would say there's a big difference between medical school and sort of postgraduate learning, because from my experience in hospitals, there's a lot of, let's say, technology integrated into education of a young clinician, but it's mainly because hospitals are going through a digitalization sort of revolution process, improvement, development sort of situation. And maybe yes, at that level, but on a medical school level, I think no, mainly because of what Hashem was talking about, because there's a huge gap between the opportunities and what is actually implemented. And I actually think that working on understanding why there's a gap is super crucial, because it's not like we don't have the technology here, and it's not necessarily because it's too expensive or basically inaccessible for whatever reason. I actually think there are many, let's say, factors which contribute to that. But at medical school level, I'd say for sure, no, absolutely. Yeah, like Hashem.
So Hashem, this is all leading up very nicely, isn't it, to the next couple of questions we're going to ask the audience.
Yeah.
So why don't you ask your question next?
Yeah, so the next question is, should we, and this is a voting question, should we abandon printed textbooks and replace them with fully digitized content? Yes or no? And perhaps Sophia can start, huh?
No, absolutely not. I love textbooks, but not because of the fact that they are really cheap and easy to carry, etc., but maybe as sort of an ornament that you look through. But I think I'm not a fan of either or, so I would say we shouldn't abandon, but we should definitely integrate digital content into the curriculum, even from the point of view that I don't think textbooks are the best way of communicating certain subjects and certain ideas. Like you said, why would I want to look at a surgical procedure on a 2D page with images that are very vague and confusing a lot of the time? I could have some sort of interactive simulation. So I think yes, no, both.
Maybe you can look at the result and see what the audience thinks. Yeah. Oh, wow. No. It looks like most people want to still enjoy the smell of the printed paper. I personally am honestly against that. I think that we need to move to digitized content, because just how long does it take to print a textbook? Yeah, before it reaches the student. By the time it's printed, a lot has changed, and it's not in that book anymore. And because of that, students are not up to speed when it comes to scientific or medical knowledge or whatever field they are studying. Besides, printing costs a lot. It costs a lot in, how many trees have to be cut and how many, it's environmentally a tedious process for our environment. So digitizing, if the technology is already in our grasp and everybody has a phone, let's say, and they all can open a PDF book, right? So I honestly think that we should move to digitized content, because it can be updated very quickly without having to wait for a long time.
Yes, you can see that. I see your points entirely, Hashem, but also from Sophia's love of the written word and the smell of the textbook as an ornament. I wonder how much of the 20% of the votes that we got was along those lines, or it's because they genuinely feel that they're a good and necessary educational tool. So we're talking much more about digitization now in this discussion. So, Sophia, why don't we move on to the next question?
Absolutely.
I'll hand over to you.
Yeah. So this question is very much linked, let's say, to what we were talking about before, and my personal interest for sure, as Hashem's and Charles as well. So the question that you need to vote on now is, should we rely on artificial intelligence and specifically maybe machine learning to replace human teachers? And that will be quite interesting to see.
Yeah, it'll be interesting to see what the result for this one will be. But if I share my thoughts,
Yep, of course.
I think that we shouldn't, essentially in real life, the outcome and these students have to deal with humans, so they need to understand the way they can interact and communicate and deliver what they want to deliver to humans. That's the end consumer of whatever you're going to do. Besides, if we basically automate everything and rely on machine learning and artificial intelligence, and the human factor is missing, it's going to be awkward. I mean, the outcome, the students will not really be socially ready for real life challenges. That will make it very difficult. That's very much like asking, would you really trust to put your child inside a self-driving car to take them to school? Yeah. So the question is, would you do that or not? That's like really putting so much trust into the machines while neglecting the human factor, which is still essential.
I would, sorry to interrupt.
I was just going to say, it's just a very interesting take, and one which I wouldn't necessarily have thought Hashem would have. But Sophia, what were you going to say?
No, I mean, for me, basically, I think any solution, it can't be either or, because replacing teachers, it's kind of like the idea of the argument anti-AI of doctors are going to be replaced by machines. And actually, from what I understand and from what I've learned over the last years, the best solution that I've seen is sort of using technology to support you, because we have certain limitations as humans, as processing units. Let's say our brains have certain limitations. For example, bias that accumulates over the course of our life, the various parameters that sort of limit us, like burnout, stress, etc. So I think a lot of the analysis and data processing and sort of modeling the future course of an individual's educational path could definitely be done through using machine learning or various other artificial intelligence technologies, but it definitely can't be without the guidance of some form of a human.
And I totally agree with that. We have to use a blend of both. Rely on technology while still having human supervision.
Yeah.
Thank you, Hashem. I wonder what the answer is.
Okay.
Nice.
Wow.
The audience are very sure on that.
Although I have to say that some professors have been entirely useless. And so I think
these ones can be replaced right away without a second thought.
Yes, there's a list in my head of maybe a few that could have been better replaced by artificial intelligence machines. Yep.
So I'm going to ask a couple of questions now, because I think we have time to do that, but just of the panel, if I may. So Hashem, do you want to see AI technologies integrated more into medical education?
I'd absolutely love to see that. Now think about some of the some analysis, all right, some analysis of some medical findings can sometimes, when done by human, there could be a margin of error, an error that can be avoided by using technologies, artificial intelligence. And so you see in the world of publications, a lot of retracted papers, because the analysis by a student or a professor who would be at a much higher level, something was missed there. And that something or that gap can be filled using technologies. And this is just one of many examples why such technologies would definitely be a great asset in addition to medical education.
And do you think the complexity and the cost of such technologies is a bar to them being used widely at the moment?
That's definitely one of the reasons. It hinders the ability to use this. But with the rise of online education, with more people being able to program these tools by themselves, I think this will become more accessible. When we talk about artificial intelligence, we're talking about mostly a program, a software tool, which can be now programmed by someone who probably learned something online, a programming language. If, let's say, each research group or hospital or medical facility or school, whatever, have their own programmers and they can create such tools, then they can definitely integrate them, and this will reduce the costs, and this will make it even more widely accessible. So I would say the costs are still there, but in the future, this will not be an issue anymore. It will just be a matter of will.
Great. Sophia, do you think there are any bars to the use of AI in the future in the medical education field?
Yeah, so for sure, elements of, let's say, why maybe we're not where we want to be, at least where Hashem and I are talking about wanting to be, and many people who are joining today probably want to see medical education to go to. I think pricing and costs are for sure one of them, but actually in my experience in the European Medical Student Association, when we were looking into this, a lot of the issues that we were having are actually to do with lack of skills and training, and the idea that you're going to have to put in a lot of money and funds, let's say, into training your staff. So anyone who will be teaching and interacting with various technologies, and of course the students themselves. And so part of what I think is the problem, maybe the element of costing, the element of the costs that are to do with the training, I think are the biggest issue, because actually a lot of the licensing for institutions and for individuals are not so great, at least from the point of view of, I don't know, my university could easily afford to integrate certain solutions and have done. So they've made huge improvements with virtual reality, clinical sort of training experiences. But a lot of it still is not optimized because of the fact that we haven't been sort of put straight into trying to make the most of it. And so I think costs are important, but the barriers I think mainly are in the bringing together the gap that we were talking about before, which is essentially what do we want, what do we have? And a lot of it relies on us as people who are in the system teaching or receiving the teaching, let's say. So to me, the skills are the biggest problem. Yeah.
Right. I'm going to bring the chat in actually just a second, because we have a few comments. And here's a good one, really. Paola Souza says, there are things machines can't really teach you. Let me put that to both of you. What do you think?
Empathy. I'm thinking of one wonderful professor who I met through internal medicine, and some of the skills that he's gained through his decades and decades of practice is completely, maybe, at least at this point, I can't see how it could be translated, because it's the very, let's say, non-pragmatic side of AI. It's the emotional aspect. It's sort of the emotional intelligence, let's say, that you develop, and essentially the reflection of certain experiences in a clinical setting onto yourself. And then how do you deal with it? So those lessons, I don't think you can, at this point, summarize.
At this point, I think that's the key word, at this point, but eventually it will. Yeah, it's just a matter of progress. Maybe right now a program cannot really learn to adapt with human needs, but eventually, as you talk about empathy, it could just be a code that could be embedded in a program so that it can adapt to the needs of the individual or the student. And essentially, there will be nothing that machines would not be able to teach you.
I can see a dystopian film being made by Hashem called The Empathy Code. But
that's a great title, actually.
Yeah, isn't it just?
We don't be surprised to see that.
Yeah. So listen, I think we've just trodden all over our next question, actually. So we have another audience voting question in here. Should we bring that up? It's, do you believe technology will someday completely replace the need for human teachers? I think Hashem thinks so.
Someday, well, definitely. It's just a matter of time. As you see, there is new tools, new technologies that are being developed that are speeding up this. And as we approach this point, it will become inevitable, and people will have to adapt to that. And by the way, this brings me to one of the points that Sophia said, is that you don't have a lot of workforce or students who are interested much in this, but I think they would eventually become interested, because a lot of students are looking into the scope of what they are doing. Does it have a future or does it not? And this is one of the scopes that would always be required. It's one of the jobs that cannot be replaced. You will always need people who can program these machines. So people will join that field, learn more, and there will be an acceleration in the development of this, which will eventually create, well, we can call them digital teachers or something, who will be exceeding in capacity human ones.
And let's ask the audience first, then we'll ask Sophia what she thinks. So some of the audience do, a quarter of them think they will. Sophia,
well, technology is always tough to accept at first, but eventually most will change their mind.
I think with this question, I would agree that yes, but only from the point of view that I don't think we can have certainty in the way that our lives are now is not going to be obviously the way that our lives are going to be in 2-3 decades time. And I feel that with education, it's very much like the changes that have happened in consultations and telemedicine, even over the pandemic. So for a lot of communities, let's say it wouldn't be normal to have some sort of teleconference call to communicate certain ailments or sort of symptoms to your teacher, to your doctor. But at the same time, there are certain bigger, like worldwide contexts that force you to change. And I think we will be forced, or let's say without external pressure, we will change, because I think actually there's huge benefits in terms of accessibility to education with providing virtual options, let's say, especially from the point of view of tutoring, because I think there's an element of baseline education that you're given in a school, let's say that the government is responsible for you to get, but also there's going to be a lot of changes in how the additional education happens. And so I don't think maybe it will happen in the next 5-10 years, because from what I've seen, the educational system changes very slowly, but for sure it could happen. And I think it will happen, and it will be quite a beautiful thing, I hope, because again, I hope it's not going to be one or the other. I think it's never going to be one or the other. It's sort of going to be an evolution of what we have now. And it would be great to see what it looks like, actually. I'm quite excited for it. Yeah.
Everybody will be able to afford education at that point. If it's just like homeschooling, yeah, you just get the machine that will be able to, teach your kids.
So I think the chat is running with my dystopian film, by the way, because the next, if we replace all the teachers, do we then replace all the doctors?
Why not? I mean, that's kind of the issue in that argument, I think the difficulty of saying, yes, it will definitely happen, I don't think it's fair to say that, because I don't think we have any understanding of what the next decades are going to bring. Obviously, some people do, and they're researching and working in the area. And I feel like the last years were, let's say, useful for me to get a grain of understanding of what maybe the future can hold. And I think that we can never say no, but we can also never say definitively yes, because I don't think that's...
There are now apps on the phone which you can download, and let's say you have a skin condition, you just take a picture and it uses artificial intelligence to diagnose the condition and proposes potential medications, which is great. However, that app probably doesn't put into account your medical history. Maybe one of the medications recommended would interact with another medication that you're taking, cross-interaction. So doctors will still be relied on for a long time. It's going to take a while before they are being replaced by machines, machine learning and artificial intelligence. So yeah, besides, I think people still do... You feel more comfortable. Let's say someone wants to break news to you, as Sophia said about emotional intelligence, breaking bad news about cancer. Hey, you've got cancer. A machine would just put no consideration into your feelings. Says, hey, you have cancer. Congratulations. Yeah. So it's different when there is a human who is breaking bad news. They will put into consideration that they're talking to another human. So it's going to be a lot of time before we get there. People will still have to learn to trust these things, which is a slow process as well.
Great. Another question from the chat as well about inequity of access to these new technologies in education. How would we try and improve that? I mean, in some ways, that's a question for all time, isn't it? How does one improve access to education for all? But are there opportunities with new technology?
Of course, I think the idea of decentralizing access to solutions is so important. But at the same time, I think we're talking from an extremely privileged position of sort of connecting on Zoom, on a computer, on a phone, in a stable internet connected environment. And so there are huge issues of accessibility to education, even within European countries. Like, for example, anywhere ex-Soviet countries I'm trying to think of. From my friends who are studying there are many, let's say, literal areas, for example, in Romania, where maybe you don't have an element of stability. And also, even in the UK, there has been a report done by a group of students from Berkeley with whom I worked, and they looked at the fact that within the UK, so this is quite recent analysis, I think literally like just a year ago, we completed it. The analysis said that there are a huge number of students within the UK, which is a relatively wealthy, well-to-do country, which kind of has a good, let's say, educational system, who don't have stable internet connections outside of the school environment. So we're talking about the beauty of digitalization, the beauty of AI, machine learning, data processing, etc. But we're still sort of talking about the best case scenario in the sense of those who have access to internet, those who have access to technology. And I think the biggest problem going forward will be ensuring equity of access to also the hardware, not just the software, not the, let's say, the idealist sort of personalized education, but literally to a laptop and to an internet connection. And I think there are many solutions for that, from government to private businesses. But that, for me, that's the biggest problem.
I think there are solutions to these problems. The first solution to the internet, which is Elon Musk is working on the global internet, which is called Starlink. Yeah, putting 64,000 satellites in orbit, which will always provide 24/7 internet across the globe. Of course, that's still expensive, but you can't rule out the possibility that eventually these kind of technologies become cheap and accessible, just like the phone was limited to rich people only, and now it's everywhere. Second, what was the second problem that we talked about? You mentioned also a second problem, the access to technology. And if you see, there is a lot of electronic junk, yeah, which is dumped by wealthy nations. Phones, you don't use a phone or you don't use an iPad. Now these things can be shipped to, fixed and shipped where they can be utilized, which is why many companies are now starting to move to recycling. But if we can ship this kind of technologies to places where there is imbalance of technology, then I think we can provide access to such quality education, which uses technology.
I think the question is if there will be people who want to do that, because I think a lot of what education is still is very much driven by profits. Let's say it's very much business oriented a lot of the time. And I feel like what you're saying is totally true. And I definitely agree with that. But I mean, for me, one of the solutions that I saw was to include the schools, the institution, as part of the, let's say, for them to have the responsibility for ensuring that their students have access, in the sense of, in the pandemic, it was very evident that a lot of people were in completely different universes in terms of what they had access to, in terms of the home country's sort of stability of anything, environment, blah, blah, blah. And I feel like the institutions, because they are, let's say, the place to where we go to obtain knowledge and skills and learn, I think there's an element of them having to sort of engage as well, much more than they are doing now, at least from what I've seen in the pandemic, in the sense of solving, not necessarily saying that there's a problem, but solving. And I think for them to solve this quite huge problem, I think many things will change, will have to change from a government level in terms of funding at least, but also on a societal level, let's say, because in the UK, for example, before I left to Italy, I never thought about access to education or equitability essentially, and disadvantages. And I went to a very good private school, but on a full scholarship. So there was like a huge difference between me and some other people that I knew, but I never internalized, let's say, the huge privilege that I had access to at the time and what it did for my academics, essentially, at the time of being in the system. So you have to kind of get perspective as well. And it's very, very hard, I think, to get that perspective and to take action when you're in it. And so a lot has to change, I think, for basically the things that we're talking about to happen. But in the way that I think it's happening now. So you and I are from completely different backgrounds, and all of us actually. So we're all basically maybe not even doctors, let's say, and we're talking about medical education in a way that's very inclusive. And I think that's what has to happen, like more conversations and more actions have to happen essentially at this level and higher levels and lower levels and every day and congresses and stuff. So yeah.
That's great. So listen, Sophia, do you want to ask what I think will be our last question to the audience?
Yeah, absolutely. So this is something that we already discussed a little bit, but the barrier, so the main barrier to change in medical education, we have 4 options here, and it would be great if you could vote on this, and it will be the last question, one of the last questions that we ask. But for now, what do you think, Hashem and Charles?
I think my dog's barking, which always happens at the end of these things. So the main barrier, I think, to medical education, I'm going to hand it to Hashem. Hold on 1 second. Over to you, Hashem.
Go ahead, Hashem. Yep.
I think that the main issue or the main barrier, I mean, honestly, they're all like interlinked somehow. Mm-hmm. But I could say that I would number them from 1 to 3. Yeah, because I feel like the last 2 are similar. So anyways, so first is resistance to change. All right. There's a large group and members of the society who still believe in the current process of the educational system. And as long as they do that, it's going to be difficult to move on into a new one. So it's our responsibility to inform them of the outcomes of improving this and moving to something of a better quality. So it's really a matter of public education to improve, to reduce the resistance to this. The second thing is bureaucracy. Definitely, things take too long and so much work has to be done before you get some decisions made. And finally, funding. So bureaucracy comes before funding, because essentially, if you're applying for funding, you have to go through a lot of bureaucracy. So but mostly I would say resistance to change by faculty.
Now I'm back. I'd say the same actually, Sophia, and I do it that way around. I think resistance to change by faculty, but I think that's much less so than it used to be. But I don't think that necessarily translates into the ability to actually exact change by the faculty themselves. People are very comfortable in their own skins as they are at the moment. And yes, bureaucracy definitely. That trips us up day in, day out in healthcare, as it does in education in healthcare as well.
Yeah. So we can look at the results of the voting as well. So funding and bureaucracy.
Funding and bureaucracy. Okay.
I was thinking about this, and my initial reaction would be to say resistance to change. But actually, I was thinking about it. The reason why I would say resistance to change, which is the same as you two, would be because if you have funding, let's say, what is, at least from my experience, I'm imagining, okay, we have a lot of funding, and then still you can't really do anything if no one wants to do it. Let's say if people are genuinely not enthused, I'm not talking about sort of doing something and sort of giving 50% to the changes, but I feel like actually to some degree, there's a counter argument to that, which is if you have funding, those who are resistant to change won't feel a pressure in terms of a budget and sort of monetary responsibility. What if it goes wrong? What if it goes right? What if it goes wrong? And all they'll see is, what if it goes right? Or let's say maybe it could be supportive in the attitude of what if it goes right, essentially. If you have a lot of money, maybe it's a
You're speaking from the perspective that those in the faculty are transparent and accountable.
Yes.
Which is not always the case, unfortunately. So that would be another barrier as well. You need to put people in the faculty who are really, who embrace change and who are accountable and transparent.
But I think also, to some degree, we don't necessarily need that, in the sense of course, it would be great if everyone is transparent and sort of not, let's say, slightly corrupt. But I think that actually, if you have companies which are able to support their own product by basically funding them themselves, or having funding that goes directly to the company that bypasses the organization, I think in that way we sort of bypass that problem. Because essentially, if you have an organization that's coming to you and says, look, literally it will cost you nothing, try it, I think it will help you, you don't need to pay anything, everything's sorted, blah, 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 then of course that's kind of a, why would you not try it? It doesn't make sense. So at that point, I think the biggest problem would be those basically with attitudes which are regressive or sort of quite stagnant. Yeah. But at the end of the day, I think it's kind of, like you said, a combination of everything. And the fact that we don't have neither extremely wonderful funding, neither extremely progressive groups of people in one place trying to push for change and revolution in education kind of comes together to make one big mess, let's say. Right. It's very stagnant and sort of sitting. And that's why we're talking about everything now, I guess.
Yeah, great points. So listen, guys, we're coming to the end of our hour. So let's just have a few key takeaway points from each of you. So Hashem, what would you like to say to our audience?
Well, I'd like to say that the current educational system is in need, desperate need for a lot of changes. And these changes require us to be open-minded and require us to integrate technology as much as possible. But most importantly, look into different methods, move to digitization, integrate technologies such as artificial intelligence, augmented reality, artificial reality, into the educational system. Try to abandon the outdated ways that have been here for far too long, and you will see the fruitful result. And it's going to be amazing.
Thank you, Hashem. What a great future we look forward to. And Sophia?
I think for me, the main point of this discussion, and maybe the work that I've been doing and what I've learned for myself, is essentially that whatever the issues are right now, we all have to make an effort to actively engage to change them. And that doesn't mean that there's a specific thing you have to do, but I genuinely believe that the changes are not, let's say, just going to happen. I think we're going to have to make sure that they do. And whatever the context of why you're interested in the session, there's a reason. And I think each one of us can find their own space in which we can improve the current medical education system. And I think it's going to have a huge impact also on basically national and international healthcare systems, and huge worldwide impacts on healthcare, let's say, in general. So it's something very exciting, but we have to not get passive, essentially. I think we have to constantly stay active. Yeah.
Thank you very much. So with those points, I think I'm going to wrap up today. It's been a fantastic discussion. We've covered a lot of ground in only just under an hour. Thank you so much to my panelists, Sophia and Hashem. You can find them both online. Go and watch their TED Talks. They're very educational. And let's continue this discussion. Let's continue changing education for the better. So thank you very much, and enjoy the rest of the week.
Thanks so much.
Thank you, everyone.